Hey everyone, welcome back to the Physical Therapy Masterclass. I'm Harshel and I'm absolutely pumped you're joining us for part 9 of this explainer series. So today we are tackling a massive, foundational piece of the physical therapy puzzle. We're going to decode the strict billing rules that separate skilled, hands-on interventions from multi-patient group sessions. If you're a medical coder, a biller, or a PT clinician, you already know that the line between these two types of care can sometimes feel, well, a little blurry. And we all know that blurriness leads directly to claim denials. But not today. Today, we're clearing it all up for good. Let's dive in.
Okay, here's our agenda for today. First, therapy interventions. Second, CPT 97140 for manual therapy. Third, CPT 97150 for group therapy. Fourth, a coding comparison. And finally, what's next in reintegration.
All right, Section 1, Therapy Interventions, Hands-on versus Group.
So according to the official guidelines, a therapeutic procedure is defined as a manner of effecting change through the application of clinical skills that attempt to improve function. Right? It's not passive, it is a highly skilled, active intervention. And here's the absolute crucial baseline rule you've got to remember. These codes generally require direct, one-on-one patient contact by the physician or the therapist. That's the standard expectation across the board. However, there is one major exception to this rule, and that's group therapeutic procedures. This actually brilliantly sets up the exact contrast we're going to explore today.
Moving right along to Section 2, CPT 97140, Manual Therapy, the skilled hands-on intervention.
Let's take a look at the clinical scope of CPT 9740. As coders and clinicians, these are the exact keywords you need to be hunting for in the documentation. We are talking about joint mobilization and manipulation, manual traction, soft tissue mobilization, manual lymphatic drainage, and myofascial release. Think about it this way. If a therapist is just, massaging a patient for general relaxation, you might actually be looking at a completely different code like 97124. But 9740? That is reserved for complex, skilled manual therapy techniques designed to actually affect change in the tissues and joints. It literally requires the specialized hands of the clinician physically working on the patient to improve mobility and reduce pain.
15. This is the crucial number for CPT 97140 because this is a timed code. It's billed in strict 15-minute increments based on one or more regions treated. So, if the therapist spends 15 minutes applying manual lymphatic drainage to a patient's leg, boom, that is 1 unit. If they spend 30 minutes doing it, that's 2 units. Precise time tracking is an absolute non-negotiable requirement here.
But time isn't the only metric we have to worry about. Look at this strict compliance rule. Direct, one-on-one patient contact by a physician or therapist is absolutely required. Meaning the clinician cannot be standing across the room, casually watching another patient on a treadmill while billing for manual therapy. No way. Their hands must be on the patient, and their attention must be completely undivided for those 15-minute blocks. This is totally non-negotiable if you want to stay compliant with 97140.
Now let's get into a really important pro-level coding tip. The National Correct Coding Initiative, or NCCI for short, actually has specific edit pairs for CPT code 97140. It indicates that codes like 97530, which covers therapeutic activities, are considered linked services when you bill them in combination with 97140. So what does that actually mean for you on a Tuesday afternoon? Well, it means if you bill both together without clarifying, you'll probably only get paid for 97140. If the therapist actually provided 15 minutes of manual therapy and then provided a distinctly separate 15 minutes of therapeutic activities, you might need to apply modifier 59. This little modifier clearly communicates to the payer that both services were provided independently, which warrants separate payment. It's such a small detail, but man, it is a massive one for your revenue cycle.
Let's pivot to Section 3, CPT 97150, Group Therapy, Multi-Patient Sessions.
To really understand group therapy, you have to understand the specific supervision rule that governs it. The key phrase to lock into your brain here is constant attendance. Basically, this means the therapist or assistant is continuously present with 2 or more patients, and they're providing skilled therapy or intervention. But here is the major differentiator. They are not providing any significant amount of measurable, one-on-one time to either patient. They're guiding the group, monitoring their form, facilitating the whole session, but their attention is inherently split.
Which brings us directly to our next big number, 1. While manual therapy was totally ruled by the number 15, group therapy is ruled by the number 1. CPT 97150 is an untimed, service-based code. You bill exactly 1 unit per patient per session, period. It literally does not matter if the group therapy session lasts 30 minutes, 45 minutes, or a full hour. Each patient in that group gets billed exactly one single unit of 97150.
So let's quickly summarize the core triggers for 97150 so you know exactly when you should be applying it. First, the session has to involve treating 2 or more individuals simultaneously. Interestingly enough, this can actually take place on land, like in a standard clinic, or in an aquatic setting, like a therapy pool. It is strictly an untimed, service-based code. And I'll say it again just because it's so important. You bill exactly 1 unit per group member. Recognizing these specific triggers in the clinical documentation is what's going to keep your billing perfectly compliant.
Moving on to Section 4, Coding Comparison and Synthesizing the Rules.
Okay, let's look at them side by side. On the left, we've got CPT 97140 for manual therapy. This code represents time-based precision. It demands direct, hands-on, one-on-one contact, and it's billed in carefully measured increments. Over on the right, we have CPT 97150 for group therapy. This represents broader session management. It's completely untimed, requiring constant attendance for 2 or more patients, but crucially, no significant one-on-one time. As you can see, they basically hold completely opposing rules for time tracking and patient contact.
And this matrix right here perfectly illustrates everything you need to remember. Think of this as your ultimate cheat sheet. For 97140, your time rule is 15-minute blocks, your contact rule is direct one-on-one, and your billing units are multiple, obviously depending on the time spent. For 97150, the time rule is completely untimed. The contact rule is constant attendance for 2 or more people, and the billing unit is exactly 1 per patient. If you just keep this matrix in mind, you are never going to mix up the compliance requirements for these 2 distinct therapeutic procedures.
Finally, Section 5. Next up, reintegration and functional training.
So, that leaves a pretty huge question for the patient's overall rehab journey, doesn't it? I mean, we've mobilized their joints and we've had them doing exercises in a group setting, but how on earth do we compliantly code for real-world functional training? How do we bill for the time spent teaching a patient to safely get in and out of a car, cook a meal in their kitchen, or safely manage a wheelchair?
Well, that is exactly what we are going to cover in our next explainer. In Part 10, we're going to be diving deep into CPT 97530 for therapeutic activities, 97535 for self-care and home management training, 97542 for wheel care management, and 97545 for work hardening. It is all about translating those clinical gains into real-world independence for the patient. I absolutely cannot wait to break it all down with you. Thank you so much for hanging out with me today. Keep practicing those compliance rules, and I'll catch you in the next one. Decode Healthcare with Harshal.